Hi, my name is Dr. Khurram Nasser. I'm the Medical Director of the Center for Healthcare Advancement and Outcomes, as well as the High-Risk Cardiovascular Clinic at Baptist Health, South Florida. I serve as the senior author on the upcoming article titled Prevalence and Outcomes of Ideal Cardiovascular Health in U.S. and non-U.S. Populations, to be published in Mayo Clinic Proceedings. In 2010, American Heart Association proposed a paradigm shift by emphasizing on promoting cardiovascular health. They developed the matrices called Life Simple 7, which composed of 4 lifestyle factors, including diet, physical activity, smoking, and weight, and 3 risk factors that were blood pressure, blood glucose, and blood cholesterol levels. Each of these individual matrices, based on their levels, could be categorized as ideal, average, or poor. By combining all these matrices, an individual is considered having ideal cardiovascular health if they possessed 5 to 7 of these matrices in the ideal range. Now, in our systematic review, looking at 50 studies published since 2010, highlighted the following findings. Number 1, the prevalence of ideal cardiovascular health status was low in both U.S. and non-U.S. populations, although with similar rates. Among all the matrices, we did poor, especially on the diet and physical activity status. More importantly, individuals who attained ideal cardiovascular health were considerably at a lower risk for all-cause mortality as well as dying from any cardiovascular death. Furthermore, individuals having higher levels of ideal cardiovascular health status or matrices were also favorably impacted by a lower incidence of diabetes, depression, cognitive impairment, as well as cancer. However, we also feel that it will favorably impact the rising burden of healthcare costs. For example, a recent study from our group demonstrated that in a nationally representative U.S. populations, those achieving optimal cardiovascular health status were associated with a significant lower annual medical expenditure as well as health resources. However, at the same time, it's a sobering reminder that the overall prevalence of ideal cardiovascular health in our population is alarmingly at a low level. This calls for specific policies that will target interventions such as achieving optimizing physical activity and diet, likely to have the highest returns in the shortest period of time. Our study findings robustly supports American Heart Association's strategic goal in focusing for optimizing cardiovascular health at a population level that will have significant impact in reducing mortality and morbidity. The American Heart Association strategic 2020 goals, as well as the associated findings of reduced mortality and morbidity, provide strong impetus for healthcare systems to rechannel our efforts rather than focusing just on treating disease, but promoting cardiovascular health. The adoption of the Life Simple 7 matrix is very easy in populations, especially for patients where it can be graphically demonstrated where they lie on the spectrum of cardiovascular health. There are proven interventions that can be initiated based on these individual matrices, and it can be used as a tool to track success. These small changes by focusing on Life Simple 7 matrices has enormous potential to improve the population health, which eventually will translate into significant benefit in forms of reduced morbidity, mortality, as well as healthcare costs. In spite of the well-defined benefits of achieving cardiovascular health status, we have a long way to go in achieving those goals among the major proportion of the population. Consensus is needed to prioritize research, and that can only be done in a patient-centric approach where we partner with our community members to understand their needs and specifically which interventions as well as matrices that we need to focus to optimize sustainable attainment of these goals.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.